Tonight, Boone County leaders say their jail is overcrowded, and part of the problem is authorities locking up too many inmates with mental health issues.
In an ABC 17 News special report, ABC 17's Dan Messinio talks to county leaders and mental health workers about what they're doing to help curb the problem.
Boone County Commissioner Janet Thompson is spearheading an effort to decrease the number of mentally ill people in the jail. And it's a problem county jails around the country are seeing. Thompson says we must maintain the health and safety of our community, but at the same time recognize that the jail might not be the best place for a substantial number of people with mental illness that are currently housed there. She and others are working to change it.
There are more mentally ill individuals in jail and prison than there are in hospitals or treatment centers. That's frightening.
County jails around the country are locking up mentally ill people in record numbers. Each year, around 2 million.
Prisons and jails are not equipped to deal with mentally ill people, and it becomes a safety risk to the individual and a safety risk to the staff.
Hannah White is one of 33 community mental health liaisons in Missouri, assessing people referred to her by police officers. And she's busy. White is the only mental health liaison for 10 counties in mid-Missouri. Her job is to keep mentally ill people out of jail by hooking them up with services and treatment. The U.S. adopted a more community-based approach to treatment after closing many psychiatric hospitals over 50 years ago.
We've gone from very large institutional settings, psychiatric hospitals, to prisons. Same settings, institutional settings, but we've not really completed the promise of having enough community resources available for individuals to live successfully in the community.
The National Association of Counties says mental illness in U.S. jails has reached crisis levels. And in Boone County, mental illness in the jail population trends above average.
National average is 19%. Boone County runs typically a third of our population presenting with mental illness.
Boone County Commissioner Janet Thompson says it's time to use county resources better to identify and help residents with mental illness before they end up in the county jail.
We do have mental health staff here at the Boone County Jail, but incarceration in a conventional correctional facility is probably not the best way to go with some of these people that are seriously mentally ill.
Officials tell me it also drains resources. Mentally ill inmates tend to stay longer, demand more officer attention, and contribute to jail overcrowding.
We're at capacity and we are constantly being challenged in that regard. We are housing a number of other inmates in different facilities in mid-Missouri.
It's also a matter of money. The day I interviewed Detective Tom O'Sullivan with the Boone County Sheriff's Department, the county was housing 18 inmates in other county jails. Many times those inmates end up here in the Montgomery County Jail. Montgomery County charges around $45 per day per inmate. For those 18 inmates, it would cost more than $800 per day. The number of inmates housed in other counties is up and down from day to day. At times, it's upwards of 40 inmates. And at an estimated cost of $45 a day, you can see it could add up quickly.
Well, we want to find a better solution for people in our community, and we can utilize our resources better than building a bigger jail and throwing away the key. That's not the answer.
The National Association of Counties is pushing for an answer. It's called the Stepping Up Initiative, encouraging counties around the country to reduce the amount of incarcerated mentally ill people.
People dealing with this problem every day agree the current approach doesn't improve public safety.
Boone County has taken up the challenge. For the first time this month, the county brought together key players from the court and correctional system. The group evaluates cases for mental health issues.
Is there something that can be done in each of these cases to get these people the kind of help they need more quickly, to make sure we are not adding in delay by what we're not doing?
This method helped Johnson County, Iowa drop its jail population by 100 inmates a day. This is where the facility will start. Employees at a company in Kansas City say they might have part of the solution. This is a large space in here. Now, you say this is going to be the observation area. Lauren Moyer with Rediscover says it's an assessment and triage center and a first-of-its-kind facility in Missouri to help people with mental illness who come into contact with authorities.
Folks who really don't need to go to jail, they don't need a ticket, they don't need to go through our legal system. They really just need a more warm handoff and get connected with the right resources.
For the first year, the new facility will only take referrals from police and hospitals. Moyer describes the facility as a bridge for people to get the right type of care.
We really get to know the person, know their story, understand, what it is they're struggling with, what resources they might need, and we do a very warm handoff to an outpatient care so that they don't have to end up at jail.
The Rediscover facility in Kansas City is expected to open in July. And as for Boone County, the commission is set to vote on funding for a project that would help develop a plan to better identify and help people who might fall into the criminal justice system because of mental health issues.
Very interesting. 2 healthcare companies want to put a psychiatric hospital in North Columbia, but it is tied up in court. The state rejected Oceans Healthcare. The company wanted to build a geriatric psychiatric hospital. Now Oceans is suing the state. CenterPoint Health has submitted plans to build a psychiatric hospital for all ages. It is unclear, though, tonight if either one will move forward.